to light, and National Indian Health Board is working to elevate issues related to the pandemic that have impacted tribal communities. Webinars in this series will cover existing guidelines and protocols on any new products, tools, resources, and guidelines needed to support tribal infection control, reopening processes, food services, environmental assessments, water, and sanitation operations as they relate to COVID-19, as well as other issues that are either exacerbated or brought to light by the pandemic. Before I introduce our speaker for today, I do want to note just a few housekeeping items, and we've all been on Zoom for quite a while, so I think we know most of this by now, but we do have folks on mute just for the sake of the quality of the line, but there will be a question and answer period at the end where you'll be able to unmute yourself. If during our speaker's presentation you think of something and want to be sure you don't forget it, you're welcome to put your thoughts into the chat box, and I can read them out when the Q&A portion comes. Second, please note that this meeting is being recorded and will be posted on NIHB's website. If you don't consent to being recorded, please do drop off the meeting at this time. And third, at the end of the webinar, I will send out a brief 2 to 3 minute evaluation. Your feedback is very helpful to us, so do please fill out that evaluation at the end. With that, I would like to welcome our speaker today. Phillip Harrison is with the Navajo Uranium Radiation Victims Committee and is an enrolled member of the Navajo Nation. He will speak on the health and environmental impacts of uranium mining on the Navajo Nation during the COVID-19 pandemic and how these issues have presented unique environmental health challenges to the Southwest. Mr. Harrison is a former underground uranium worker and previous remediation specialist with a Department of Energy uranium mediation projects at the old rare metals mill in Tuba City, Arizona. He has served on the Navajo Nation Council from 2007 to 2011. And with that, I will turn it over to Mr. Harrison.
Yes, thank you. Can you hear me okay?
Yes, you're coming through loud and clear.
Okay, I'm sorry. Yes, I'm Phil Harrison. I'm an enrolled member of the Navajo Nation. And I am a former uranium worker and also a remediation specialist at a contaminated site, stabilizing contaminated materials in Tuba City in Arizona. I am the lead consultant for a grassroots committee that was formed in the late 70s from the communities of Red Valley, Arizona and Cove, Arizona. And as you know that this community had engaged in a uranium boom from 1950 to 1966. And many of the community members, mostly young men, went to work when the uranium mining was introduced. And throughout the years, after 20 years, many of those workers got sick. And so nobody was warned of the dangers of mining and the deadly consequences of exposure to uranium radiation and other toxic chemicals and toxic substance. And people never had worn any kind of PPE or respirator. And they all got sick. These were the days where actually it wasn't uranium mining. These were the days where dog hole mines were being done, where they started out with the donkeys taking the uranium out of the holes. So as time went along, some ventilation came into the scene in the latter part of the 70s. But I want to let you know that the adverse health effects of many uranium workers, the latency period for that was like 20 years, and which is exactly true on my father. After 20 years of uranium mining, he died from lung cancer at age 44. And he was never warned about the dangers. And I understood English when I went to work with my father and in the mines of Southern Colorado. And nobody told me about the contaminated water or the radiation or the pollution that's in there. And I got sick in 1999, and I went through a major surgery, and I didn't have any health insurance, and I was not compensated for my loss. But this is typical among many people. I want to say that in the community of Red Valley and Cove, we lost approximately 400 fathers, 400 uranium miners. These were our family, our relatives, people from other parts of the Navajo Nation came in and mined uranium. So far, we probably have over 400 widows that are out there taking care of their family. And along with that, families that were living among the tailings, among the mines, some of these spouses also have died from the same symptoms from lung disease as their husband. Now we have young people that were born in 1950, 1960s. They're being diagnosed with kidney disease and respiratory issues, and this is what we're encountering now. So with all of that happening, as a grassroots committee that was formed in Red Valley, we pursued a lawsuit which did not go anywhere. So we changed our directions to Congress, which the first law was done October of 1990, just to compensate your underground uranium workers, which did not go far. So we started an amendment process, which was done July of 2000. So that's where the Department of Justice compensation program was implemented. Now, after 31 years, it has not fulfilled its intent. We have a lot of people that has not been compensated yet. The program's policies are very stringent. You got to be dying to get compensated. You got to have lung disease diagnosis letter to be compensated. So this has been a barrier to obtain compensation. So the program, its intent has not been fulfilled yet. And this is the need there's a need to extend the program and expand it with the proposed for my two of them were my Uncle Roy passed, Uncle Phillip passed 2 weeks ago. So loved ones, and many of them have not been compensated.
Sorry about that. I think with your most recent thoughts, that would be awesome. Thank you. Thank you for your patience, everyone.
Okay, yeah, I noticed that you went off on, but anyway, in conclusion, the legacy of uranium mining and radiation exposure has taken many lives. The family members are devastated and still grieving for their loved ones. We have suffered many years with this type of tragedy that happened on the Navajo Nation. And before all this mining started, the communities of Cove, Red Valley, they were farming. They were really happy. Families were really close. Nowadays, there's no farming because our land is damaged. It took like almost 30 years to reclaim these abandoned mines. With all those years, a lot of our aquifers are contaminated with radionuclides. So all of this has happened with the legacy of mining. So we have been approaching and working really hard to address this through members of Congress. And as you know now that today I had a chance to speak about the introduction of the radiation exposure compensation amendment that happened by Senator Crapo and Senator Lujan that happened this morning. So I'm proud to say that, you know, things are picking up and we're looking forward to have Congress with a little heart, they can amend this law and give people chances to submit a claim for their injuries. And I know that America is liable for these damages and it's taken us this long to resolve that. And I wish that, you know, that something could be done as soon as possible to help our families. Thank you.
Okay, So I think now would be a good time for question and answer. And while folks either think of your thoughts or just develop a question that you might have in your mind, Mr. Harrison, could you tell us a little bit more about that legislation that was introduced and what it would do for folks on the Navajo Nation and surrounding areas? And again, if you're interested in asking a question, you can either use the hand feature or unmute yourself or type it into the chat box. So, Mr. Harrison?
Yes, can you hear me okay?
Yeah, you're coming through loud and clear.
Okay, I'm sorry. Yes, one of the most important things that is on the proposed amendment is that we want to extend and allow compensation to post-71 miners. We lost many of them to COVID. Some of them have already died. Those are workers that worked between 1972 and 1990. The other thing that we're looking forward to is that I sincerely hope that members of Congress will raise the level of compensation from 100,000 to 200,000. Because one is that the 911 responders, they're getting millions of dollars for cancer. If they have lung disease, they're getting compensated at 800,000 and more, while our miners are getting only 100,000. So I think that still there's an injustice there. The other things that we like to see is medical benefits for these post-71 miners, and medical benefits for the downwind people that are suffering from cancer. Some of them are going through treatment. Some of them are surviving after they go through chemo. So we like to have the downwinders be covered with medical benefits. The other thing we'd like to see is that we're asking for $3 million to do an epidemiology study among the uranium families, spouses, and children, to see what the pathways are and to see what is really out there as far as adverse health effect is concerned. The other things, making it easier in the use of affidavits to support a claim. And that's what we're looking forward to. And I was part of the consulting back in July of 2009 when we brought this issue to Washington. We had to introduce. So it's been taken us a long time to improve this bill and to expand that, and we're looking forward to that, and we're losing people in times of the essence.
Thank you so much for providing that overview. Okay, we can certainly open it up for anyone who has a question about this topic.
Hi, Mr. Harrison. How you doing? I have a quick question for you. So, with the CDC having these guidelines about hand washing, can you just talk a little bit about how Navajo Nation, what they have been able to do in terms of like filtering the water systems, or how they have been able to treat or, like what type of systems have been put in place to remove some of the uranium and some of those hot spots that's on Navajo right now during COVID?
Yes, I, being a former tribal council, it didn't take, when this COVID hit, this pandemic hit, it didn't take no time for the media, the news media. They had predicted that the indigenous nation, the Native American people, are going to be hit hard with COVID. And they already know that we are going through a lack of infrastructure, a lack of sanitation facilities. It costs so much to extend the water line. And for years and years, this has been happening. And that's one of the reasons why I think a lot of Navajo people has been hit with COVID-19. Most of these systems are in a cluster of communities where the access to water was there, where Indian Health Service through Public Law 86-121, they have built these systems, and later they were transferred to a Navajo Tribal Utility Authority they're the ones that does the treatment with fluoride and at a community system. So I'm not sure exactly what's out there up to now, but I know as a young man growing up, as a child growing up, our well was just down the wash. This wash was coming off the mountain where the mines were. So far, that water point is shut down. I did testify before Congress in 2007 about the Navajo Nation uranium contamination. Since then, there was a directives made by former Congressman Waxman to do an assessment and to address these contaminated structures, contaminated water. So far, I have not heard anything of the accomplishment of really what's been fixed and what is still out there. But in my community of Cove, there's some abandoned mines that has not been cleaned up yet, simply because of the geographic location, the access to these mines. So since the money started in 66, and they didn't start remediation until 1995. So all these years, the horizontal mines, the inclined mines, the surface mines, all these years, rainwater has gone into these mines, and eventually it came back on the aquifers. So that's where the contaminated water structure is. And I know that it's going to take a lot to fix this. And I think there's a lack of concern from the federal government. I always have said that the liability for these damages falls back on the government. Yet, it's taken us this long to provide a remedy.
We do have a question in the chat box about the federal legislation. Can family members of those who worked in the uranium mines receive the compensation owed to them after they've passed due to the health effects of their exposure? So they're not necessarily workers themselves, but they're family members of the miners who may or may not have been exposed.
Yes, sir. But this is a process. It's not easily said and done. They have to go through a stringent criteria. A miner has to be dying. And you know what the Navajo people says on this whole thing? They comprehend this law as having a foot on the grave and a foot on land. You have to demonstrate through chest x-ray, pulmonary function test, blood gas test that you're injured. And some of them, they pass away before they get compensation. One man died, after he died a week ago, his favorable decision came in and said, you will be compensated when the gentleman had passed away. It takes a long time. But the family members or a spouse or children, they are considered as beneficiaries. And it takes a lot of paperwork, especially processing a claim for like 10 members of 10 family or 6 in the family. Each one of them's got to have a packet. So there's a lot of frustration to it. There's a lot of paperwork to it. And it takes almost a year or more than a year to get compensated. It's just a long delay to get your answers right. So yeah, family members do get compensated, providing they have the right paperwork done.
Thank you very much. Yeah, and that's important to know, and it is very frustrating, that length of time that the process takes.
And can I just go back to one question, Mr. Harrison? When you was talking about the how Navajo was testing some of those wells, have they developed, just if you know, so we can probably share this with some people in the audience, do you know if Navajo has developed like a best practice guide for hauling that water during COVID-19, or if they have developed a protocol for testing the water that's being consumed for like pregnant women or babies right now?
Since the directive was made by Congress on this contamination, they have identified those wells that were contaminated. They have put up signs preventing the use of it. A lot of these wells are shut down. I don't know if any of the new wells has been drilled with water. I'm not sure about that. But many of our families that don't have sanitation facilities, they're still hauling water in worn down cans, worn down pickup trucks, and the whole thing still exists out there. I don't know when everyone will get to have running water inside their homes or their communities. Understand it is so expensive to extend these water lines, and there's some policies to it. There's you got to have merits to have a water system put in place. And I used to work for a water utility company, and that's the reason why I know that some of these wells were contaminated, and the distribution system, and it's just a whole lot to do. That's very, very expensive to place a community water system.
And we have a comment in the chat box related to your what you're saying. The wells are still contaminated. A lot have not been cleaned up, and people are still accessing those wells, even though the signs are up. So do you have any thoughts there around how folks can, either, be made aware of the contamination or have other sources of drinking water? And there's a follow-up comment. Community health representatives had been and have been diligent with attempting to get water to the homes, and especially those CHRs that know which clients need water. And yeah, we've seen that in other communities. The CHR, the community health representatives, are such an integral connector with public health services with community members. So I don't know if you had any thoughts there.
As far as I know, there's been some public service announcement going out on the airwaves to Navajo people in Navajo. They're being told about the contamination that exists out there. And then some chapters at the government, we have 110 chapters in the Navajo Nation. A lot of these chapter houses, they have watering points. And I think many of those people are now getting clean water from their chapter. I think the word is out to do that. We do have health programs under the Navajo Nation, such as the community health representatives, local medical facilities. I think they're out there now teaching people not to do that. I recently met a lady. She lives out in the Grand Falls. Grand Falls is located between Flagstaff, Arizona, and Tuba City. And for years and years, the people of Grand Falls has been drinking that contaminated water. And many of them have thyroid disorders. Some of them died from cancers. And understand that they still use that water. I know at one time, I hauled like 20 cases of water to that community, just volunteering to deliver drinking water to Grand Falls people. Since then, a gentleman that was directing traffic there as a volunteer, hauling water in his rundown truck, he died from cancer. So I don't know who is doing all of that, helping our elderlies to get clean water. So I would think that that's even happening now, even though there's a sign there that says that contaminated water do not use. And I know where that's at, and I know people do have access to it. So this young lady says she's from there, and she didn't know, even though it was happening, because she doesn't really reside there, and she's been mostly out of that area. But I do hear that the people still have access to those water.
And do you know, has that been impacted by COVID at all? I mean, certainly the Navajo Nation last year underwent some pretty intense lockdowns where travel on and off the reservation was functionally impossible. Did that disrupt the water delivery to the elders and other folks that depend on those services?
I have a grandma that she helps with advocating for RECA changes, and we did travel with her to Washington. Her son was volunteering out there delivering water, and I have not heard of anything that had deterred from him doing that. So I think that a careful consideration of getting out there is taken in, and I know they're all being safe. As of today, the radio station from Farmington, New Mexico, a former leader was talking about getting vaccinated and all the awareness about COVID-19. So the word is still really getting out there through the airwaves, and that's going on from Farmington and from Gallup, New Mexico.
Thank you. So I'm reading another question from the chat, and we've been talking kind of about groundwater and drinking water, but has there been any work done to sample or test the radionuclide concentration in air within Navajo Nation?
As far as I know, when the contamination at the milling sites or the abandoned mines during the remediation, they had these radon gas detectors and high volume air system that was posted around the area to catch any kind of contamination. That went on for a while, but nowadays, I don't know if they have any kind of detection for radon or detection for radiation is out there. I know Cove, we have a community school at Cove. The premises at that day school, the day school's been years. That's where I started school in the mid 50s. And that school has some hot zones, and there was radioactive that was existing. So they shut down that school. Now, I don't know if they're going to set up any kind of a monitoring system to detect radiation or to detect radon gas that exists at that school.
Thank you. So I'm just gonna read a couple of things in the chat. And again, feel free to unmute yourself as well if you prefer to ask your question that way. There's a comment that some of the chapters are giving out 5 to 10 gallon containers to community members so that they can access clean water from their chapters. And I should mention also, and Mr. Harrison, correct me if I'm wrong, for those of you that are not familiar with Navajo Nation's government structure, if you think of Navajo Nation like a nation, then a chapter is kind of analogous to a state where they do a little bit more localized administration. And then also, there was some water delivered, but were left out for weeks in the sun. And unfortunately, that water was still given to families, but they were told not to drink it and just use it for bathing and to give to plants and animals as well. So I don't see anything else in the chat. So let me ask Mr. Harrison, and you've mentioned it a couple of times that the liability for this falls back to the federal government. And I wonder, what does successful remediation of this look like to you? Is it the federal government coming in and cleaning it up and saying, okay, we did a job and now we're done? I mean, what kind of does the relationship with the federal government and Navajo Nation look like? As far as what you want it to, what do you want it to look like as far as remediation is concerned?
I've been to Cove not too long ago. I drove and I did see a remediated site. There was a shaft and the ore waste is still sitting there. And I understand the remediation has taken place in the late 90s, early 2000s, but the contamination is still there. The earlier remediation that was done by the Navajo Nation abandoned mine land, a lot of these places, it's corroding from the rainwater, and they're uncovering what the cover was on there. And I'm not sure about if there was a cell structure that was done, and I don't know where it was taken to, but all of those need repair. But with this happening, I always have said that the land is not going to be restored to original shape. It's going to last for a long time. It's going to exist. So like I said, before the mining started in Cove or on the Navajo, people used to farm, ranch, and people were happy. But when all this contamination started coming in, there's no more farming. Everybody goes to Walmart for their food. There's nobody that lives off the land now. Those farmlands are full of weeds, and like I said, in Cove, Arizona, nothing. The mining companies that left the area, the damages they left behind, they didn't come back to see what the community wants. The only thing that Kermit Gee gave us was 2 steel picnic tables. They're still sitting out there in Red Valley right now. That's the only thing we got. But as far as who is in charge of this is the Navajo Nation Environmental Protection Agency is vested with the authority to overlook the cleanup process. This is under Region 9 of San Francisco. So I understand that the cleanup is continuing. There's EIS still being done, and church rock contamination is still there. So I don't know how long contaminated material is going to sit there and contaminate other things and release radon gas in the atmosphere. So I don't think the land's going to be fully restored to original shape.
Great, thank you for that perspective. And I do see someone with their hand raised. Chris, do you want to go ahead and unmute yourself and ask your question?
Thank you. Yate, Phil, it's Chris Shuey.
Oh, yeah, there, Chris.
How are you?
Doing okay.
Good. I would just add to this discussion that we're hundreds of years away from getting all 524 abandoned uranium mines on the Navajo Nation fully remediated. EPA Region 9 has a 10-year plan that it released early last year, hasn't gotten a lot of attention because of the pandemic. But in that plan, they have assessed 111 of those 524 sites, but they don't really give themselves credit for fully remediating a single one. There have been about 5 places where there have been interim removal or interim containments. There are places in the Church Rock area that Phil mentioned that have had soil contaminated with radium and uranium around people's homes removed. But the Northeast Church Rock Mine, the Kerr-McGee Church Rock Mine, all of those are still waiting remediation. The process under the Superfund law is excruciatingly slow. There's really not too much talk about expediting this need for remediation to protect the existing communities. In our work, we find that people on Navajo, at least the older people, have lived at their homes in the same place for parts of 3, 4, 5 decades. They're not transient, they don't move. So if they have mine waste around them, they're captive to those exposures. And this material is highly toxic. Because it's sit around for so long, it's got a thin veneer of submicron particles, which are easily inhaled. We've done experiments in the labs at the University of New Mexico that shows that some of the mice that are exposed to the fluids that are derived from these dusts exhibit cardiopulmonary toxicity to their lungs immediately. So we're quite concerned about trying to get not only the places cleaned up, but to mitigate exposures, mitigate risk by making sure that the people know where these sites are, that they stay away from them until they get cleaned up. And most important, that the communities are directly engaged in the discussion of remediation strategies. And that's not been something that you would think would be common. It's not. It's improving as time goes on, but the burden is so massive. And as Mr. Harrison said, the federal government's responsibility for this has not really been fully accepted. If we get the RECA bills now that have been introduced passed, that will be one step, a good step in the right direction. But the government started the uranium for the Manhattan Project in the 1940s. It continued through the 50s, 60s, and into the 70s and 80s. And to this date, the government has never fully accepted that responsibility for the acquisition of uranium for the nuclear weapons program. So anybody listening to this has concerns about it, and the National Indian Health Board has concerns about it, we'd be happy to provide background information so that you can advocate for not only the RECA expansion, but for the broad cleanup. And it's not just on Navajo, it's on indigenous lands throughout the Western United States. Yeah.
Thank you for providing those comments and that perspective and that context. That's very helpful. Okay, I see Nikki has their hand up, and I think you're unmuted, so go ahead.
Okay, thank you. She Nikki Bigay and she Kisani to the Chini National Najini Bushes Chin, Kaden Ed, the Shado Todini Dashanoa. Good afternoon. Yes, I was the one that added the little comments in the chat box about as far as the water issues on Navajo, just to provide some information. And I think Dr. Kashui didn't really give as much credit for some of the studies that do happen on Navajo, which is one of the ones that he works in partnership with us on the Navajo Nation, which does have to do with pregnant moms and children being, looking at children possibly being born with higher than normal levels of contaminants in their system, predominantly uranium, and seeing if it has an effect on their development and their growth. So, and through that study too, there were also tests that were done on Navajo Nation at many of the well sites that were contaminated. Also, we have other studies that are on Navajo Nation too that are ongoing, that have been ongoing, that can give you information regarding a lot of the well sites and what have you. And I came on board with the Navajo birth cohort study back in 2016, actually 2015, and in 2016 was when they introduced this whole 5-year cleanup with the EPA, all these people to clean up all these mines, and we're going into 2021, and there's still a lot of work that needs to be done. A lot of these well sites that have not been upgraded, that have not been fixed, a lot of the chapters have resorted to getting these water sources at their chapters, and I was a part of that. Mr. Shui, Dr. Shui was one that also gave out information to a lot of us as field workers. We cover not only, everybody's assigned to a different agency within Navajo Nation. There's the Northern, Southern, Western, Eastern, Central Agency. We, cover all of these areas. We are still actively recruiting pregnant moms. And in those studies too, Chris and his team go out there and they're the ones that actually do the radon testing within the home. They're the ones that go in there and make sure that the environment is safe. And from there, we do our assessments. We go in there, we build a rapport. We see what water sources that these families are, where they're getting their water from and what have you. If they're using filtered water, if they're using a pipe system in from Navajo Tribal Utility Authority, or if they're still hauling water, and if they are hauling water, where are they getting the water from? What kind of containers are they using? Are they safe? Are they up to date? I know that the chapter is also putting out these 5 or 10 gallon containers that you can get from the chapter. And they have their water sources there. They also provide chlorine tablets that you can add to the water to try and make them safe. But yes, a lot of these families are still accessing water from these contaminated well sites to, do their laundry, to drink, to consume, to, I am, do have the uranium within my family. My late grandfather was one of the ones that used to, the one that used to transport the uranium. And in his ending days, he had colon cancer. But whether he could prove it or not, the downwinders is what they call. So he was working at a site out at Cove. That's originally where my great grandmother comes from and where she resides from. She was a traditional herbalist. She was a medicine woman. She, she taught me a lot. She lived to be 108 years old. She passed away when I was in college. I'm now 40 years old. And, I did get my degree, and there's still so much work that needs to be done. Like I stated, you know, when 2016, this whole big old plan, you know, EPA is going to clean up. We have our 5-year plan. We're going to clean up Navajo. You know, yeah, and a lot of those people that were on that plan are working different jobs now. And there's only so much we could do, but yeah, the COVID, the pandemic definitely hit Navajo Nation hard, and would have been nice to have seen this 5-year cleanup also include clean water for our people. Uranium doesn't have, from what I understand, doesn't have a lifespan. Doesn't say, okay, I'm going to be radioactive until this day, and I'm going to stop on this day. There's an expiration date. Slap one on me. And unfortunately, with the downwinders, my grandfather, like I said, he worked out in Cove, but where we live right now is his land that he gave to my mother, which is a 9-10 acre plot. We farm it. We have our livestock. I have my children there. My mom and my dad are next door. And because a lot of these people that had that access to, you know, that livelihood to try and provide for their family and, you know, to put food on the table and have, you know, provide the basic necessities for their family, you know, they really got gypped big time. In the end, my grandfather didn't want to fight for the money. You know, that's the way he raised us. You know, money will only take you so far, but your character speaks loud for itself. How we raised you, the teachings that you come from, the compassion that you have, not only for your family, but for your people, that's what speaks louder. And that's what's money's not gonna define you in your ending days. What you do for your people and what you do for your family is what's gonna speak louder, and that's what's gonna carry on, the legacy that you leave behind. So that's, you know, how I was raised, and I'm sure a lot of people on Navajo Nation are in the same situation as me, where they watch their loved ones suffer towards the end. And it was all in the name of, you know, providing for their family and not knowing the dangers of what this uranium can do. And so many decades later, we're still going through it. We're still facing it as a Navajo Nation, and the pandemic definitely did not help with access to clean water, with access to certain things that we should have. And, you know, we could blame government, can blame federal government, but also within our own tribe, within our own people, we have the means of helping our own people. And, you know, I speak for myself that it's unfortunate that we're still fighting to have, you know, basic necessities such as running water, electricity, even Wi-Fi for our kids that are going to school via virtual learning, because COVID did hit the Navajo Nation hard. But I just also wanted to add that in there that, you know, I feel that Dr. Chris Shuey didn't give a lot of credit where credit was due. I think he's a, you know, very humble man. I've been working alongside him, and I know that he has that compassion and that heart for our people too. And it's, you know, I wish that a lot of our leaders would see that there is work being done on the ground. This comes down to a matter of, you know, getting outside your comfort zone and really seeing what's out there, because there is that compassion, there is that love. There are things being done on Navajo Nation to look at these things, the level of contaminants in the water, in the air, in the environment. There are many studies being done, even looking at the blood work of our children too, you know, seeing what's going on with them, because we want to help our future. So I just wanted to add that in there. Thank you for giving me the time. I appreciate it.
Absolutely. Thank you so much, Ms. Begay, for those words and your story and your perspective. I do want to follow up with you offline about the work with pregnant women, because National Indian Health Board does have a maternal mortality project, and I think there may be some overlap and some opportunities for collaboration. So I'll reach out to you about that in a little bit.
Is that the ECHO study?
I'm sorry?
Is that the ECHO study?
Oh, it's the project we have is on maternal mortality review committees. But yeah, I'll follow up with you offline about that.
Okay, thank you. Sorry about that. Okay.
Oh, sure. You know, you're fine. Looking at the clock, we have just a few minutes left together, but I did want to point out some resources that are in the chat. on a map of abandoned uranium mines on Navajo Nation, as well as a link to the EPA, that's the Environmental Protection Agency, their Navajo Nation uranium cleanup plan, so you can see those. And I want to make sure we get to the questions that we have remaining in the chat box. I see two. Mr. Harrison, what are your thoughts on using phytoremediation processes in an attempt to remove some of the radioactive contamination? And if I understand phytoremediation correctly, that's involve utilizing plants and soil and biomass. So do you have any thoughts on that and how that can be productive for Navajo Nation?
Yes, I'm not really into the as of now. My focus has primarily been on the amended the 2000 RICA law, and that's where all my efforts have been going. As far as reclamation and cleanup is concerned, I'm just hoping that the Navajo Nation Environmental Protection Agency is doing all of that. So I'm just thinking that that's taken care of. So like I said, my focus really has been on amending the law, and I primarily had a lot to do with drafting these changes to benefit our people. So that's where things have been.
Thank you so much for that. And then we do have a question actually for Dr. Shui. What are the best ways to include community members in the remediation strategies that you mentioned? I don't know if you wanted to talk, and if you wanted to, I see you put some thoughts on phytoremediation as well. If you wanted to expand on that, you're welcome.
Well, as my colleague Nikki Begay explained, this issue is huge. It could take up 3 hours of your time just talking about it. I will say positively that many communities that are affected by uranium waste and uranium mining on the Navajo Nation, Pueblo, Laguna, all throughout the West are really increasingly really wanting a seat at the table when it comes to these plans to clean up mine sites. The plans to clean up mine sites are, as we said earlier, lagging behind. Each site gets its own Superfund attention, assessment, plans for remediation. At each step, the community can be a part of that by providing comments, but it can't sit at the table as EPA makes decisions, either with corporations that are responsible for the contamination or with other levels of government. This is a kind of a systemic weakness of the Superfund laws, Comprehensive Environmental Response Compensation Liability Act, that people throughout the United States have had since CERCLA was enacted 30 some years ago. But the good part about it is that folks in the communities are saying, listen to us. We want these wastes, in some cases, out of our community. We want our land back to heal ourselves, to heal our health and our lives and our families. We have to heal the land first. Phil Harrison mentioned that. Nikki Begay mentioned that. So I think that there's reason to be somewhat optimistic as we go forward, but the issue is huge. The Navajo birth cohort study, which Nikki mentioned, has morphed into the National Institutes of Health's ECHO program, Environmental Influences on Child Health Outcomes. We have lots of preliminary findings that we'd be happy to share with you, Mr. Weber.
I'd be happy to share those if you have something that we can send out throughout our contact list. I'm happy to do that. It looks like we just have a couple of minutes left. I do want to thank my colleague Dree Marzette for sending in the evaluation for this webinar. Again, like I mentioned at the beginning, please do fill that out. It does help us with feedback and to provide other quality webinars that are relevant to your work. Mr. Harrison, I just wanted to ask if you had anything you wanted to add in closing before we wrap up today.
This year has been pretty exciting with the RICA been introduced today. And I have been telling people that the rest of the Western society really doesn't know, what happened to our people in the 60s and 70s. And I said, all those people that we have reached out to, they need to get out and learn about what the indigenous people has gone through all these years at the expense of nuclear weapons program. So I do appreciate that today it coming before the National Indian Health Board. I really appreciate the opportunity to express my concern and share with you what our people has been suffering. We lost a lot of good people, and it's not going to stop there. And yes, money's not going to bring them back, but at least there's going to be some sort of reparation that's going to happen. And I asked in Congress to pass this amendment.
Wonderful. Well, thank you so much for your time and your expertise and sharing both of those with us today at the National Indian Health Board. Please join me in thanking our speakers and everyone who contributed to the conversation today in this webinar. Again, we will be posting this on National Indian Health Board's website in the coming days, so be on the lookout for that. Again, do please complete that evaluation. It should take about 3 minutes. And with that, I hope you all have a good rest of your day, and I hope you all learned something and are going to be able to take this back to your work in your community. So thank you all so much and have a good rest of your day.